night here in Cincinnati, over 1,000 people experience homelessness, and approximately 25,000 people annually here in Cincinnati. A quarter of those are children, and half of those are under the age of 5. Racial segregation. The Cincinnati primary metropolitan statistical area, okay, so that's a scope of geographic area that excludes Butler County, is the 8th most segregated area in America. Income segregation. In addition to segregation by race, Hamilton County also has areas of concentrated poverty. Transportation and affordability. In the Cincinnati area, the combined cost of housing and transportation consume 56% of a household's annual budget. So when you look at housing affordability, classically you just look at income versus the cost of your housing, but there's some new thought into, let's also look at what's the cost of transportation, right? So getting to and from work or to and from where you go takes up another big part of your income. So there's some really interesting research going on around transportation affordability. Moving on, substandard conditions, lead poisoning. In Cincinnati, 93% of our homes were built before 1979. Therefore, they're likely to contain lead-based paint, which can cause lead poisoning in children. And I do just want to say there is a very energetic collaborative here that crosses multiple groups that is working around lead issues. And Carol Igo, she's on in our membership of AHA, and she's a very active member with that. So if you want more information around lead poisoning and lead issues, we can get that to you. Finally, accessibility. The percentage of accessible CMHA units, again, that's our public housing authority, is barely 4% in Hamilton County. Yet statistics indicate that 9.8% of our total population has a physical disability. So again, that means we clearly do not have enough affordable units that are truly accessible for the number of people who need them. So in conclusion, those of us who know and work with individuals and families looking for affordable housing have clear anecdotal evidence, day in and day out, that there's not enough. This report tries to at least provide some actual data points that people can take a look at to support, their intuition that clearly we are in a crisis around affordable housing here. The last slide just names who is on the AHA board. We meet monthly. There's a membership meeting. I have up here a membership form if you're interested in joining. It's only $25 a year for individuals. We do a number of advocacy efforts, including this report. I'm kind of wrapping my part up because I think it would be really helpful to have some open discussion. There's a lot of people here, and I think that may be interesting. We could do Q&A or just kind of open, however you want to do it, Bill. But I also want to mention a publication that if you work around downtown, you may see some street vendors. They sell this publication called Street Vibes. It's operated out of the Coalition for the Homeless, and I just want to mention that AHA, we submit an article every 2 weeks into this publication, and we talk about policy issues related to affordable housing. This last article is in our current issue. I happen to write it. It's called "Those Darn Facts Trump Section 8 Myths." And it talks about that you can find hard and fast data around subsidized housing choice voucher, and it kind of pulls out some data points to battle against those stereotypes and stigma that you often hear about folks who use these sort of subsidies and what the reality is. For example, they're just a bunch of people who don't work, or they just have a bunch of kids, and the things that you hear. And when you really look at the data and the information, it will help you be a more stronger advocate to say, actually, that's not true, and let me tell you why. So that's why we're here. We're here to encourage advocacy. We're here to share information. And with that, I think I'll hand it back.